When the cartilage wears away, you feel every step. That grinding friction at the joint line eventually stops you from climbing stairs, taking a walk, or even sleeping through the night. To fix it, you need a knee replacement. The National Joint Registry data shows the clinical success rate is high, and the physical outcome remains the same whether the procedure occurs in a private hospital or on an NHS ward. Patients arrive at a fork in the road. They must choose between enduring a multi-month wait for free care or paying an out-of-pocket sum to proceed immediately. To help navigate this choice, we are using the 2026 data compiled by the Best of Health, the UK's resource for over 50s navigating the healthcare system. This decision centers on whether you prefer to retain your financial capital or use it to reclaim your mobility and time. This timeline compares the two paths. Look at the bottom track. In 2026, the average NHS wait from GP referral to surgery is 28 to 29 weeks. On the top track, a private patient reaches the operating theater in 4 to 6 weeks. That 6-month gap has physical consequences. Living in daily pain restricts your movement, and over half a year, that inactivity leads to muscle atrophy, joint stiffness, and weight gain. Medical data shows a direct correlation here. Patients who enter surgery in a weakened physical state face a slower and more difficult postoperative recovery. Many choose the private route to ensure they go into the operation physically strong, making the recovery process easier to manage. Accessing the faster timeline requires funding the procedure yourself, securing financing, or relying on private medical insurance. The Best of Health tracked the exact costs across 162 different private hospitals in the UK to find out what patients actually pay. This chart illustrates the spread of those costs. Prices depend heavily on the provider and location. The most affordable options start at £10,226, while hospitals in London often reach £19,740. The median average across the entire UK market sits at £15,700. Hospitals usually sell this as a fixed-price package. That bundle covers the surgeon's fee, the implant, nursing care, and a private room. Be aware that out-of-pocket extras exist. Pre-surgery MRI scans and physical therapy sessions beyond your first follow-up are rarely included in that baseline price. A fixed package protects you from surprise bills for theater time, but you still need a cash buffer to cover the diagnostics leading up to the procedure. In the NHS system, the hospital trust assigns your surgeon based on availability. You rarely know who is performing the operation until the morning of the surgery. Private care allows you to interview and select a specific, named orthopedic surgeon. You can pull their historical data from the National Joint Registry to verify how many successful knee replacements they perform each year before you commit. You also work with that surgeon to select the specific implant materials, choosing the hardware that matches your bone density and expected activity level. Private healthcare serves as a mechanism to guarantee certainty regarding the surgical team and the materials used. The experience differs after you wake up as well. An NHS patient typically recovers in an open, multi-bed hospital ward, while a private patient recovers in a dedicated room. That private environment offers single occupancy, a personal bathroom, and a quiet space away from the noise of a general ward. It also ensures continuity of care. The consultant who performed your surgery is the same doctor who checks your progress and clears you at your final follow-up. On an NHS ward, shift changes mean your recovery is managed by a rotating cast of nurses and junior doctors from the wider surgical team. Opting for a private room removes the stress of a crowded ward and ensures you are managed by a single, familiar doctor throughout your stay. Covering that £15,700 average usually involves paying up front or filing a claim through private medical insurance. For those without insurance, many hospitals offer financing plans. You can often break the total cost into 0% interest payments spread over 10 to 12 months. Structured financing allows you to access surgery immediately without the need to liquidate your entire savings account at once. This decision tree maps the best path. If you have complex health conditions requiring specialized support or live on a strict income, the NHS is the appropriate choice. The trade-off is a 29-week delay and the physical discomfort that brings. In return, you receive safe, comprehensive care without risking financial instability. When protecting your long-term financial security is the priority, the NHS is the superior path. Look at the other branch. With a manageable budget and a priority to return to an active lifestyle quickly, the private route fits your profile. The cost is a significant reduction in your personal financial reserves. The benefit is reclaiming active life, choosing your surgeon, and ensuring a quiet recovery. Choosing a private hospital is a strategic exchange of financial resources for time, personal control, and physical preservation. If considering the private route, request quotes from at least 3 different hospitals and verify their safety records on the Care Quality Commission website. For more guidance on surgeon outcomes and local wait times, visit thebestofhealth.co.uk. Weigh your time against your finances. Determine which trade-off you prefer to make